Welcome to SVG-TV News for Wednesday, January 22nd, 2025. I am Rochelle Batiste with the details. The late Ormiston Arnold Kenbo, a former member of Parliament for Central Kingston, was laid to rest today. The day's event began at the Parliament building in Calico, where the flag was flown at half-mast. Parliamentarians and members of the public were given the opportunity to view the body, which lay in state for 2 hours. Among the first officials to view the body and pay their respects were Governor General Dame Susan Duggan and Prime Minister Dr. Ralph Gonsalves. Speaking about Kenbo, who passed away on January 1st, 2025, leader of the opposition Dr. Godwin Friday shared that he had known Boye for many years but had come to know him particularly well over the past 2 decades. Dr. Friday described Boye as a visionary whose entrepreneurial spirit will be greatly missed, emphasizing that such qualities are much needed in the country.
He has been a fixture. He has been a very important person in the business life of this community and in the politics, very well respected, a man of entrepreneurial spirit and vision, and that's the kind of thing that we need in this country. And he, in his way, building his businesses over at ECGC and all the things that he did over the years is an example for people as to how you should keep pushing the envelope and to make something more than what we have now. And that was Kenbo. He was a nation builder in that respect. And so, of course, we know he was involved in the politics as well. And we've had some conversations during that time and after. And he was an inspirational figure, truly. So I think it's well deserved that he has this attention here today in the official funeral. And those who come out to pay their last respects today would be really well deserved.
SVG-TV News also spoke with Minister of Foreign Affairs Frederick Stevenson, who shared his thoughts on the popular businessman Kenbo. Lawyer Stanley Starkey John also gave an insight into Boye's political life, describing him as a genuine and true patriot.
I remember as a youngster growing up, I heard of him as manager of what is now Vinlec, but it used to be called, I think, CDC. Then I knew him in relation to ECGC and Kentucky Fried Chicken. And then I remember his political sojourn with the ULP, and then with the party that himself and Starkey John formed.
Ken abhorred tribalism, political tribalism, and the reason that we were moved to launch the People's Progressive Movement was because we felt that that was a means of trying to bring the country together, to bring people together. You will note that at all stages in his political career, he spoke to and acted in a way that fostered Vincentians working together, not pulling apart. And I think that is the signal and most outstanding feature of his public life in St. Vincent. He was consistent in his commitment to all Vincentians from all walks of life.
Members of the public as well as former parliamentarians shared fond memories of Boye, recalling the various ways in which he had interacted with and touched their lives.
In dealing with him, he was a man who walked his talk. When he promised something, he promised it. He had a good heart.
What I remember most about him is that when I was a rookie journalist at NBC Radio 705, he gave me an interview, and that changed my life.
To say that there is much to cherish, much to embrace, much to emulate, I thought he did a very good job.
I think that his legacy is one of greatness, to put it, cap it mildly.
Well, he was really a trailblazer in business, and he was a good example for aspiring business people.
And there's no way today is the final word. That I could have been absent, you know. I remember he said to me that Ms. Williams, honesty is the only policy that you can go through this world with. It is a sad moment for me this morning.
The church service was followed at the Cathedral of the Assumption. At the church service, tributes continued for the popular businessman. Prime Minister Dr. Ralph Gonsalves, who is also a first cousin of Boye, was among those paying tribute. The Prime Minister expressed his deep sorrow, saying he was pained and saddened by Boye's passing. He also announced that an official funeral had been approved to honor a great man of the soil and a cherished family member.
Today, a grateful nation says farewell to a favored son in an official funeral, as instructed to be held by me. The American poet of the world, Robert Frost, speaks to Ken and others of our tribe. I shall be saying this ages and ages hence. Two roads diverged in the woods, and I chose the one least traveled by, and that has made all the difference. On behalf of the government and people of St. Vincent and the Grenadines, on behalf of my family and me, I express sincerest condolences to his widow Shanda, my friend, and to all children, the grandchildren, the family, everybody. May my friend and my first cousin, wild love, may he rest in peace.
In his tribute, one of Boye's sons shared that he had learned many valuable lessons from his father, which had helped shape him into a better person, both in business and in life.
The simple moments I spent with my father shaped me. Growing up away from my dad was not always easy. Life and circumstances had us physically apart. But as you know, it's easy to hide in the shadow of a giant. And Ken indeed was a giant. Knowing his expectations, standards, his drive, his commitments to excellence, his desire to constantly do better, shaped me. Being apart, I felt him, I felt his expectations, and equally, I missed him. My dad was a larger-than-life figure, and without trying, he would fill any room with his presence. He cared about making people comfortable. He was a generous and gracious host. I admired his charm, his probing mind, his sharp and incisive judgment.
Boye is credited with introducing Kentucky Fried Chicken to St. Vincent and the Grenadines in the mid-1980s. May his soul rest in peace. In other local news now, we hear that St. Vincent and the Grenadines continues to experience economic growth despite the disasters that occurred in 2021 and the years that followed. This was noted by Prime Minister Dr. Ralph Gonsalves today while speaking on NBC Radio's face-to-face program. The Prime Minister acknowledged that Hurricane Beryl had negatively affected growth last year, but he pointed out that the country is expected to see more than 5% growth this year.
Just want to remind everyone that we have been having substantial economic growth since post the volcanic eruptions, and we were growth in the region of 5% or more. And we were on target for a similar growth this year by the middle of the year. I mean last year, by the middle of last year. But burial upended that. But we're still going to have substantial economic growth because though burial knocked off 1/3 of the country's GDP in economic loss and damage amounting to nearly $1 billion. And housing is about 450 million of that. Because of the construction program and the uptick in towards the end of the year in tourism, the extent of burial damage and loss would be reduced to the extent of a pickup later on.
Meanwhile, the Prime Minister addressed the rising cost of living that Vincentians continue to face. He noted, however, that the government has taken steps to mitigate the impact by offering support in several key areas, which were outlined in the 2025 budget.
Ensure that what I said Independence Day the year before, that we pay you a 5% monthly supplementary income tax free. We have done that. And we did so beyond the initial 6 months period. It's continuing to this year. We committed to ease the pressure of inflation on vulnerable Vincentians, and we have unveiled a raft of innovative interventions that have caused to cushion the increased cost of living, which rarely those increases come from outside. Fuel, imported goods, and so on.
The transformation of healthcare in St. Vincent and the Grenadines is an ongoing process, and healthcare delivery has undergone positive changes over the years. This is according to Minister of Health, Wellness and the Environment, Sinclair Prince, during his contribution to the 2025 budget debate. Minister Prince noted that efforts have been made to upgrade, modernize, and expand services, making them more affordable, accessible, and equitable.
Madam Speaker, despite all the negatives that we've been hearing, let me just say, and I would insist, that this health system in St. Vincent and the Grenadines is not a shambles. It is a health system boasting 45 health facilities within reach of all Vincentians. 10 minutes and you get to a facility. It's a health system which continuously is being reformed and modernized. It is a system with an excellent maternal and child health record. A system which is awarded by WHO PAHO for eliminating mother-to-child transmission of HIV and syphilis. A system which provides hemodialysis care for 70 persons at the moment free of charge. It is a system which provides decentralized dental services throughout the country at minimal cost. And I'll talk a little bit more about that later. A system where ambulance service with 14 vehicles are spread throughout the country. There's one time when we had only 2. I remember that as a young journalist having to report on that. It's a system of expanded modern and decentralized diagnostic services with MRI and CT scan and mammography machines and the like. It's a system which has been accredited by the Caribbean Association of Medical Councils, designating the Milton Cato Memorial Hospital as a teaching hospital. That came last year. It's a system where the DPP, that should be the WPP, sorry, World Pediatric Project, has designated St. Vincent and the Grenadines Hospital as a center of excellence for pediatric care. A system with its own gynecological oncologist, which maybe only one other country in the region has that specialty. A system with over 20 consultants, registrars, senior registrars, medical officers, interns. We have increased the number of interns.
Minister Prince emphasized that while he acknowledges the system is not perfect, he firmly believes a veritable revolution is taking place in healthcare in the country. In addressing some of the immediate challenges the healthcare system faces, Minister King pointed out that the most significant health issue confronting the nation is the impact of non-communicable diseases on the population.
Diabetes and its complications, hypertension and heart disease, cancers, these are placing a heavy burden on our public health resources and are responsible for most premature deaths. I had said, when I answered a question in the House some time ago, that the ischemic heart disease was the leading cause of death in St. Vincent and the Grenadines. I didn't get a chance to say it was so for a long time. I see honorable member for Central Kingston was trying to get me to say otherwise. No, we don't. Our response to these public health threats has been focused on both primary and secondary prevention. The acute hospital being constructed at Andersville will bring tertiary prevention by way of cardiac catheterization and neurosurgery for patients requiring these services. Our focus, Madam Speaker, however, remains primary prevention, in that more people must be tested, more people must enter care and treatment for chronic non-communicable diseases. We'll be talking about our primary healthcare system, that we want to deepen it and expand it by taking the services to the people in their locale, and that we should give it to them affordably. We are saying that we should do more, and we will do more, especially with particular emphasis on the NCDs. And we have added to that group of NCDs, we have added mental health.
Minister Prince also noted that they have identified 4 cancers for immediate action: colorectal cancer, breast cancer, cervical cancer, and prostate cancer.
Underline them, Madam Speaker, because again, these are at the base of our problems as far as mortality is concerned here in this country. Evidence-based protocols have been developed and will be implemented in 2025 for these priority cancers. These screening programs will be brought directly to the communities where they are needed. Again, this is a hallmark of our system. We take the services to the people. In some instances, for example, breast cancer, we will promote self-referral. This will allow people to access mammograms by having to first consult a healthcare provider. Of course, the eligibility criteria will be made known. Cervical cancer is by and large preventable. And I know the officials in the ministry will launch a cervical cancer program very, very soon, because they are of the view that this is a problem in St. Vincent and the Grenadines. We know that most cases of cervical cancer is attributable to human papillomavirus, and we are now in advanced discussions with some partners, including PAHO and the University of Miami, about expanding cervical screening program to include HPV testing, among other things. Access to HPV testing will be made free of cost to the population, the same way dialysis is provided free of cost. If we want people to do what we want them to do, we have to give them incentive. And we have been subsidizing a lot of the healthcare here in St. Vincent and the Grenadines, right across the board.
The Caribbean Community CARICOM High School Agriculture Competition has announced its revised winners, recognizing 3 outstanding schools for their exceptional contributions to sustainable agricultural practices and solutions. Georgetown Secondary School here in St. Vincent and the Grenadines, which combines modern techniques with traditional agricultural knowledge, took the top place. Mopan Technical High School of Belize, which focus on agro-processing and value-added agricultural products, took second place, showcasing a strong commitment to rural development. The Pleasant Vale Secondary School in Trinidad and Tobago, which focus on food security and community farming initiatives, came in third. The competition serves as a platform for fostering regional collaboration and empowering the next generation of agricultural leaders. CARICOM officials expressed pride in the creativity and dedication displayed by all participating students, with the revised winners demonstrating a high level of skill and a vision for the future of agriculture in the Caribbean. One of the teachers of the Georgetown Secondary School involved with the project, Makisha Peters, said the win is seen as an opportunity to motivate the students to be more involved in the school's agriculture program.
It was a Youth in Agriculture CARICOM video for schools to promote sustainable agricultural practices and to also highlight the agricultural programs that are in the school. We had 16 students from across all levels, and these students are actually participating in the school garden competition. that is going on right now. So 16 of them and some teachers, well, we are very happy with the winnings, and we are also very glad that we finally now have some funds to put into our agricultural program, because our agricultural program is in dire need of funds. We have limited tools, we have limited resources, so this money will go a long way. Also, the students are now more motivated to participate in our agricultural program. So we are very happy, and we are quite pleased with our winnings, and the children are also happy.
The winners will be awarded prizes and recognition at a ceremony later this year as part of CARICOM's ongoing commitment to supporting youth involvement in agriculture and food security.